Ready? Okay.
Hi, my name's Kristen. I'm a nurse practitioner and I'm going to be doing your thorough exam today. I'm going to wash my hands before I do that. How are you feeling today? Good. She appears pleasant, dressed appropriate for the weather and her age. I'm just going to take a look at your skin now. And I don't see any visible lesions or nodules anywhere. I see a few freckles and I need to measure something. So the freckle is less than 2 millimeters in diameter, not raised, smooth, no protrusions anywhere. And then I'm going to look at your head now. Your skin is pink, warm, and dry. Hair is evenly distributed. Tell me if you feel any tender spots.
No.
Okay, no nodules, no tenderness, curly, thick brown hair. And your face, can you smile? Symmetric. I don't see any visible lesions. I'm going to have you sit up on the edge or just sit right there. Okay. Now I'm going to check the sensation on your face. I want you to close your eyes and just tell me if you feel soft or dull, or soft or sharp.
Sharp. Soft. Sharp. Soft.
Okay, symmetric facial sensation bilateral. And I'm going to have you open your mouth. I'm going to just feel your joint here. Open and close, open and close. That feels nice and strong. And I want you to close and clench your teeth really tight. Okay, that feels nice and strong. And then I'm going to have you turn your head towards my hand. Don't let me turn. Turn your head towards my hand. Don't let me turn. Okay, that's nice and strong. And then I'm going to look at your neck. And your trachea is in the midline. No deviation, no nodules. Do you have any tenderness?
No.
Okay, I'm going to feel for your, if you can tilt your head up just a little, I'm feeling for your thyroid gland. Okay, and that does not feel, is that tender?
No.
No nodules, not enlarged. I'm just going to feel it from behind as well, if you can kind of turn that way and tilt your head up a little. I'm feeling, tilt your head back just a little more. For the lobes and the isthmus, and non-tender, no nodules, nothing feels enlarged. And I'm going to feel for your lymph nodes. I'm going to do your preauricular, posterior auricular, occipital, tonsillar, submandibular, tilt your head up a little, submental, superficial cervical, deep cervical, clavicular, infraclavicular, and deep clavicular. I don't feel any tenderness, and I don't feel your lymph nodes. And now I'm going to do look at your eyes. So I want you to watch my fingers, or look at me. Tell me when you see my fingers.
No. No.
Okay. And now I want you to just follow my finger. Okay, no nystagmus. Able to follow my finger. And now I'm just going to look at your eyes. Can you take your glasses off for a minute? And eyebrows are symmetric. No nodules, no lesions. And I'm just going to kind of feel your eyes. No nodules, no lesions. And I'm going to, your eyelashes are evenly distributed and they're symmetric. And I'm going to look at your palpebral fissure. And that is symmetric, the openings are symmetric. And I want you to try to close your eyes. I'm just doing some resistance here. And you're able to close your eyes, so that's good. And now I'm going to take a look kind of at your corneal reflex. Just look straight ahead. Okay. Straight ahead. Pupils are equal and reactive to light. They're about 2 millimeters in diameter. And I'm going to shine the light in between your eyes. And I'm looking for any, it's clear, slightly nasal. Okay. Now I'm going to take a look in your eyes. And I'm going to turn on my ophthalmoscope and just adjust it accordingly. Okay. And I just want you to, I'm going to turn the light down. I want you to look at, just look straight ahead. And I see the red reflex, and I'm following that in. And I see the vessels and the arteries are evenly distributed, no papilloedema. I'm following those in. And I see the optic disc. It's yellow and oval. And I'll look at your other eye. And I'm going to just look at your ears now. They are symmetric. Do you have any tenderness?
No.
Okay, no nodules, no tenderness. I don't see any obvious discharge. I'm going to take a look in your ears now. And this is on, and it might feel a little pressure here. And I see pearly gray, I see the cone of light, I'm following that. I see the umbo, the short process, the handle of malleus, and no redness, tympanic membranes intact. No discharge, no cerumen. And I'm going to do a couple tests now. I want you to tell me if you hear this equally on both sides.
Yes.
Okay? Now I want you to tell me when you don't hear this anymore.
Okay.
Now tell me when you don't hear it anymore.
Okay.
Okay, so bone conduction is greater than air conduction, and you're able to hear it equally on both sides. So don't expect any hearing loss. I'm going to do the whisper test. So I want you to repeat, I'm going to stand behind you. I want you to repeat the sequence of letters and numbers that I tell you.
538. 612.
Okay, good. Now we're going to take a look at your nose. And I just want to, I'm just going to feel your nose. Tell me if it's tender at all.
No.
I'm going to kind of push on it a little bit. Okay. I'm going to just occlude your nose, and I want you to take a deep breath. Okay. Stay. All right. Now I'm going to take a look in your nose. Feel to up a little bit. And I'm just visualizing. I see the septum is not deviated, no redness, no ulcers, no nodules, non-tender. I'm going to check your sinuses now. Tell me if that's painful or tender.
No.
And tell me if this is painful or tender.
No.
They're frontal and your maxillary sinuses. Okay, non-tender. And now I'm going to check for illumination in these sinuses, transillumination. And it is present on both sides. That's good. And now we're going to take a look at your mouth. So I want you to open your mouth. Here, let me use my pen light here. Say ah. Okay. And your teeth are all intact. Mucosa's red, or pink, not red. Nothing swollen. And tongue blade here. So what I'm going to do is have you say ah again. I'm going to put tongue blade down. Uvula is midline. Soft palate rises when you say ah. Tongue, I want to take a look. Can you stick your tongue out? No white patches. I want to kind of tilt it to the side a little. Okay. I'm going to push it this way. Try to push back. Stick your tongue out. Okay. I'm going to lift your tongue. Everything is intact. There's no redness, no ulcers, no lesions. Did anything hurt when I did that?
No.
Okay. So now I'm going to, oh, and I want to take a look at your back of your mouth. Say ah again. And your tonsils are there, but they're not swollen, no exudate. Okay, now what I'm gonna do is have you just kind of lay back again. And set your glasses over here, or you can put them back on. I'm gonna just feel for any heaves or thrills. And I don't feel any. And now I'm going to listen to you. Okay, so deep breath in and out. Deep breath in and out. So no adventitious breath sounds, lungs are nice and clear. And what I'm going to do now is check for tactile tinnitus. I want you to say 99.
99. 99.
Okay, and I don't feel any. And I want you to sit up. And I'm going to listen to your back. Oops. Well, I should turn you around a little so that... Deep breath in now. Deep breath in now. Deep breath in now. Deep breath in now. Okay. And now I'm going to check for tactile firmness. Say 99.
99. 99. 99.
And I'm going to check your tenderness here of your kidneys, costovertebral angle tenderness. And her lungs were clear, no adventitious breath sounds on the posterior side. So tell me if this hurts.
No.
Tell me if this hurts.
No.
Okay, that's good. And I'm going to have you lay back again. And now I'm just going to kind of do a little percussion. And nothing sounds dull. And I'll percuss the back side too. All 7 points. And nothing sounds dull there. And I think I forgot to check your gag reflex. So I would have put the tongue blade down your throat and had you gag a little bit. Okay, but we can verbalize that. Now I'm going to listen to your heart. So what I want to do is have you lay, I'm going to lay you supine all the way back. And I am listening, push up a little bit. Aortic. S1, S2 I hear, strong, regular, pulmonic. Herbs point. Tricuspid. And mitral. And I'm going to listen with the bell of my stethoscope. Aortic. Pulmonic. Herbs. Tricuspid. Mitral. Okay, S1, S2 present, everything sounds good. What I'm going to have you do now is sit up. And what I want you to do is lean forward, if you can. And I'm listening to your aortic and pulmonic. And then what you're going to do is lay back and kind of turn a little bit onto your left side, just slightly. Just like that. And then I'm listening to your mitral, and tricuspid areas. And then I want to listen to your, while I'm here, apical pulse for 2 minutes. I'm going to find the apical area, which I have to feel for. And I feel it. I would measure it. Should be 2 to 3 centimeters in diameter, and it is. And I'm going to listen for 1 full minute. I will listen to this area. And I'm going to sit you up 30 degrees, roughly. What I'm going to do is measure your, look for jugular vein distension and measure your pressure. That seems a little, I want you to turn your head slightly to the left. And I'm going to find your jugular vein. And I found it. And now I'm going to take an index card. And I'm going to go from your sternum, measure in centimeters. And it is less than 3 centimeters, which is what I want. And I don't see any jugular vein distension. And now I'm going to lay you back, and we're going to look at your abdomen. No, I'm not doing that. What I'm going to do is check your pulses. Sorry. Okay, I'm checking your pulses. I'm looking at your fingernails. Your skin's pink, warm, and dry. I'm just feeling your temperature. It feels warm on both sides, equal temperature on both sides. I'm looking, no clubbing of the fingernails, checking capillary refill. It returns in less than 2 seconds, back to pink. Skin turgor, I'm checking on top of your hand, and it bounces back in less than 2 seconds. I'm going to feel all your different pulses now. So I'm going to feel your carotid, and I want to do both one at a time. And then I'm going to feel your brachial, which you can feel in a couple different places. Okay. So this was 2+ strong and regular. This is 2+ graded strong and regular. Radial pulse, 2+ strong and regular. I would take the time to check the rate as well. And then we're going to do your femoral, which will be down in here. Strong, regular, 2+. I'm doing your popliteal. I'm going to just slightly bend your knee and kind of force my fingers in. 2+. It's hard to feel. It might be 1+, strong and regular. And then I'm going to feel, you have these shoes on, so I'm going to try to slip my fingers down and feel the dorsalis pedis, which I feel, 2+ strong and regular, and your posterior tib, which I'm going to kind of just use my fingers behind your ankle and feel, 2+ strong and regular. Okay. Now I'm going to check your abdomen. So I'm going to lay you back. I'm going to just take a look at your abdomen. Just look at this way. Okay. I'm going to just, okay, no lesions, no scars that I see. I'm going to kind of lightly feel. This is light palpation. Do you have any tenderness? Okay, good. And then I'm going to do deeper palpation because you have no tenderness. Do you have any tenderness?
No.
Okay, good. And then I'm going to listen to your bowel sounds in each of the 4 quadrants. I don't see any hernias or anything, so I'm just going to listen right upper quadrant, and I would listen for 1 minute in each quadrant. Left upper quadrant, left lower quadrant, and right lower quadrant. And I listen for 1 minute in each quadrant. And now what I'm going to do is, I don't know if you need to just tilt your head up a little. I'm looking for any hernias or anything, and I don't see any. And then I'm going to feel for your liver. So I'm going to do the hooking technique on the right side here. I'm going to put my hand under you. And you're going to feel some pressure. And I don't feel any swelling. The liver does not feel enlarged. Now I'm going to percuss to find your liver span. So I'm going to start down here, and I'm going to just kind of move up, listening for dullness. and that sounds about right. And I'm going to start up at the top and go down. And I hear dullness, and it looks like it's less than 7 centimeters. And then I'm going to just kind of percuss the rest. And I'm going to feel for your kidneys from behind, which I don't feel. And I'm going to come over here and feel for your spleen. Which I don't feel. And now I'm going to sit you up. Oh, I need to percuss your bladder as well. Okay. No dullness. And now from abdomen, I'm going on to, I'm going to have you check your range of motion. So I'm feeling your joints, no tenderness or anything. I want you to do what I do, raise your right arm. And then put it back down. And then I want you to adduct it. So go like this and abduct, which is away. And then I want you to extend it behind you. And then we already did. And I want you to put it behind your, like that. Did you have any trouble doing any of that? Okay. And now I want to do your elbow. So I want you to do this and then back down. And then hand palm out. And then palm over. And then I want you to put your wrist down, wrist up, and then prone, yeah, like that, and then put up, and then down, and then turn it over, and can you move it kind of towards your body, and then away from your body. And now I want to do your fingers. I want you to squeeze my fingers, and you squeeze equally, nice grip, bilateral, and then we're going to do your thumb, so I'm going to push your thumb down, and I want you to try to push it up, okay? And then I want you to kind of move your thumb out, away from your hand, and back in, okay? And then I want you to turn your neck like this, and then extend it up, and then touch your neck to your shoulder, your ear to your shoulders, both sides. And then turn it to the left and turn it to the right, okay? No trouble with that, and no tenderness. And now I want you to stand up. And I'm looking at your spine and I'm feeling it. I feel the bony processes. Okay, and your shoulders are symmetric, and I want you to bend forward. Touch your toes. Okay, now bend back towards me. I'll kind of help support you all the way back. Okay, good. And then turn this way, and turn this way. Okay, and then I want you to, you're going to lay down, and I'm going to look at your knees. Lay down. Okay, knee up, and pull it towards your body. Okay, and then back out. And then bring it out towards me. Well, slightly bent here. Out towards me. Back across your body. And then kind of tilt it in. Like that. Okay, and that. And then your ankle. I want you to kind of push towards me. And then I'm going to push it up. Do you have any pain? No. Okay. And then your hip, I want you to kind of flex your hip a little and kind of cross your body, and then put it back, and then lay it down, and then stand up. And I want you to stand with your eyes closed, feet together, and we do this for 30 seconds. And she's able to stand the whole time, so that's good. And then what I'm going to do is have you walk there and back, and I'm watching her gait, and turn around, and she turns smoothly, arms swing at sides. And then I'm going to have you hold your arms up, palms up, and I'm going to try to push your hands down, and she's able to bring them back up. And then I want you to touch your nose to my finger, okay, and you're able to do that without any difficulty. Now I want you to put your hands on your thighs and turn them, and turn them, and turn them, and turn them. Okay, good. And now I want you to, I'm going to just feel sensation on your face. Tell me if it's sharp or dull. Or sharp or soft?
Soft.
Okay, I'm going to do your arm too.
Soft. Sharp.
Trunk. And I would do her lower extremities. I don't have much to work with. Tell me if it's soft or dull.
Sharp.
Okay. Good, symmetric everywhere. And then I'm gonna draw a number on your hand. Don't look, and I want you to tell me what it is. That's accurate. And then I'm gonna put something in your hand, and I want you to tell me what it is. Let me find something. I did have a paper clip, but I can't use that anymore. Okay, tell me what this is. Okay, good. And then I want you to have a seat. And I'm gonna check your reflexes. So we're gonna start with the, let's see, the brachial. So I'm gonna kind of support your arm, and I'm gonna hit my finger. Good, okay. And I'm gonna do the radial here. Just, yeah. Okay. And then we're gonna do the, I'm gonna scoot back a little so I can do your knees. Okay, and then I would have you do your abdomen. So what I'm going to do is just all 4 quadrants go toward the umbilicus, and there's smooth contraction each way. And then the ankle, I'm going to just hit slightly behind your Achilles. Okay, and then I would take your shoe off, and I'm going to check your reflex here. Okay, good. And I'm gonna have you just move your foot towards my hand, push down, no pain or tenderness. Okay, and I'm done.